Hello. I'd like to thank you all for watching. I believe we all, in conjunction with local fire departments, hazmat, our local hospitals, and the health department, make up the front lines of defense from infectious disease in our county. We've all been planning diligently to help control and prevent infectious disease in our community. With the onset of the Ebola epidemic in West Africa, and with a few cases reaching our shores, the CDC decided it would be a good idea to implement better guidelines for response. So as a result, we did so. We must now disseminate all this information to you guys. We know that the disease has affected at least 15,000 people with over 5,000 deaths. We still don't know a great deal about the disease, but what we do know is how to protect you guys from it. Even though this epidemic is waning in the media, it does not mean we should let our guards down. We must still be vigilant. So today, we've assembled an expert panel to discuss what we are doing for protection and prevention, as well as what we will do should an infectious disease case show up at our front doors. I hope you enjoy. Jason Evans, Training Lieutenant, Manatee County EMS.
And I'm Carrie Harder. I'm an epidemiologist and the Director of Disease Control at the Florida Department of Health in Manatee County.
Jake Sauer, Lieutenant, Operations, Manatee County EMS, and Exposure Control Officer.
Chris Gould, Hazard Materials Team Coordinator for Manatee County, also Battalion Chief with Southern Manatee Fire Rescue.
All right, so let's get started with our questions and discussion. We'll start off by Ebola. When to use the term exposure, and what exactly defines an exposure when we're talking about Ebola?
What we're looking for with an exposure to Ebola, you need direct contact in order to catch the disease, and it's not something that's airborne. So whether it's direct skin to skin. However, the concerns, because it's such a severe disease, they're kind of broadening the term of exposure. If someone's actively infectious and someone's around them, and we're concerned with PPE, and if there's any type of breach in PPE, whether or not we can discern a direct contact, that's something where we would label at least a level of exposure and concern.
Gotcha. So we're more concerned with their bodily fluids, correct? I mean,
Correct.
that's the main
Mode of transmission.
mode of transmission for exposure is bodily fluids, right? Okay. Any secretions, whether it be vomit, emesis, actual contact with their blood, airborne droplets if they sneeze, so all those things could be
All those things,
potential
including sweat,
infections.
yes.
Okay. All right, very good. So what are some key questions we should ask the patients who we suspect that may have been exposed to or are exhibiting symptoms of Ebola?
So like developed in the plan, there's a couple key questions, three, that we start with. Have you traveled outside of the United States, or have you been in contact with someone who's traveled outside the United States within the past 21 days? If they answer no, then you proceed with routine EMS care. And if they answer yes, then you would go to question number 2, which is, have you traveled to West Africa in the last 21 days, or been in contact with someone who's traveled to West Africa in the last 21 days, specifically the regions listed in question 3. And have you been in direct contact with someone who has traveled to Liberia, Guinea, Sierra Leone within the past 21 days? And if they answer yes to all 3 questions, then you would contact your supervisor.
All right, very good. So, hand washing. It seems to be such a very simple thing to prevent the spread of disease. And I know compliance with hand washing, I mean, if you stood someone in the hospital when the crews come in and stood them next to the sink and actually measured compliance to hand washing, I mean, it probably wouldn't be as good as we think it is or as it should be. So I think hand washing is just such one of those small, important things that everyone could do to prevent the further spread of disease. So I think that's something everybody can improve upon, and even our crews can improve upon that. Okay, as far as the PPE removal, the whole donning aspect. How important is to have someone observing that whole process?
It's very important. What we're trying to do is, for the sake of thoroughness, have one person assigned with a checklist that walks the medics and the crews through the step-by-step doffing process, the disinfection process, the taking off of the PPE. This makes sure, ensures that we do a complete and thorough job. Fortunately, this particular virus, the Ebola virus, is very infectious. It doesn't take a lot to get someone sick, so we're going above and beyond to try to ensure that we don't get any cross-contamination. So that's
Good.
one method.
Awesome, very good. All right, so why are we using a waterless decon?
Unfortunately, actually, shouldn't say unfortunately, the waterless decon provides a couple different things. Mainly, it's the direction that's been given to us from the CDC. When dealing with this, with this virus and this disease process, we're trying to go to the source where everybody's getting their information from. And we were directed by the CDC that the bleach white is a better way to go, and it's their preferred method. The other portion to it too is that the standard hazardous materials response to infectious disease for decon and doffing is to use a water, more of a car wash system, for lack of better words, which leaves you with a lot of runoff that has to be contained and disposed of. Right now, unfortunately, there is no clear direction from EPA about what to do with this water. Until we can get some clear direction, we're kind of moving towards the waterless system, which is still very effective. It's just unconventional by hazmat means.
Right, seems like if you were to use a water system, it'd be just a lot of fluid and potentially tainted fluid that you'd have to contain and dispose of. It seems like
Yes.
it'd be a logistical nightmare.
Yes,
For all
and
that, yeah.
until we get the direction, we don't know, and we have just batches of disinfected bowl of water sitting there, so.
Right. Okay, so let's move on here. So what process is in place at our local hospitals to accept and treat infectious disease patients? I know in going by Blake and Manatee, and I've observed them doing drills, so I know they have their own plans in place. They have their own suits, their own PPE, their own guidelines that they have to go by. So they're definitely all prepared for when that day comes, if we did get a patient and we brought them there. They have a whole set of plans and their own PPE and their own guidelines that they're gonna go by to accept these patients when they come in.
The good thing in the plan that we have developed is we, right from the start, if we're gonna go down the way of the plan, is we get the Department of Health on board, who can notify the hospital that we're potentially working with this if she thinks that it's something that is definitely going to be looked at as Ebola. So the key in our plan is early detection, start getting people on board that are involved with it, and notifying the hospital so they can be ready when it arrives.
And each hospital has designated a specific isolation room, so they're all ready for the anticipated arrival of any potential patients.
Good. Isolation room, that sounds very good for an infectious disease patient. All right. So, I don't know if you guys are aware, but is there any tracking, in our companies within Manatee County, in the companies that send people overseas for business ventures or for research or for any other reasons, is there any tracking of people going in and out of Manatee County that are going to Africa or West Africa, visiting these
There
areas?
isn't any tracking going out, but there is coming back into the United States. Everyone who's traveling directly from one of the affected nations in West Africa is being routed specifically through one of 5 major airports. At that point, they're pulled aside for screening from the CDC at a designated quarantine station, asked questions, screened for fever if they have symptoms, and then gone over their risk factors for exposure. Were they a healthcare worker while they were over there? Do they know that they were in contact with someone sick? Do they handle dead bodies? Based on those questions, it'll be determined if they're high risk or low risk for developing disease. Everyone who lists a final destination within a county in Florida, we are notified through the Department of Health, our Bureau of Epidemiology.
Okay.
And at that point, if they're low risk, meaning that they don't know that they had any contact with anyone sick, they can come here, let's say example Manatee County, we will receive their address, contact information, and then backup information for an additional contact in case we can't get a hold of them. And at that time, we start twice a day, face-to-face temperature monitoring for the 21 days from when they left that affected area, to make sure that they don't develop symptoms. And then if they do, we're hopefully the first ones to know. They're given guidance, my phone number, after hours number, if at any time they develop symptoms, to call me first before presenting to a hospital or calling 911. So that way we'll kind of have a head start and advise them to stay isolated, away from everyone else until we can get everyone on board, to coordinate transport. If they do say that they're, a healthcare worker or someone who was exposed to Ebola within one of those countries, what we are advised to do is put them under what we're considering voluntary quarantine. So for those 21 days, we are asking them to stay within their home, bedroom, restroom, away from everyone else in their family, and we'll continue to do that twice a day face-to-face monitoring, but because they have a higher level of exposure or risk that they're set aside from other household or family contacts. And I believe in Florida that I know of, there's only been one so far in, I think, Brevard County. And what Brevard ended up doing when they received notification of that nurse coming in is they let EMS know, they let their hospitals know, so everyone could just kind of be on an elevated high alert, that there was someone in their county.
Everybody's aware. That's good. That's a great
And then
Great plan to
that
have
would-
in place.
That would trigger some things within the 911 system as well. Then we would start screening the 911 calls for EVD if we had a suspected case.
Very good. They have a lot of great plans in place for this. Okay, so let's move on here. So, let's see. Okay, so HIPAA. HIPAA, still something that's very important. And how important is this with such a media-crazed event, and what do we kind of have to keep in mind here? I know if we were ever to get a case in Manatee County, it would be a media frenzy. They'd probably, be listening to their scanners, they'd want to show up on scene, they'd want to start asking questions. But it's still very important to keep HIPAA in mind. I mean, there's not a lot of information we can, or any information we can really divulge to the media.
Absolutely. You can take that from an EMS standpoint.
Nothing would change for EMS. I mean, the way we go about the call as far as HIPAA goes and regulated protected health information, that doesn't change for EMS. It's not any different. And any questions the media had or anything to do with that would be referred to the Department of Health.
And we're tied by the same HIPAA rules. At most, we can acknowledge, yes, there is a suspected Ebola patient. We can't give any demographic information or anything beyond that. But, we know the media has a way of finding those things out, but it can't come from us.
Sneaky media. All right. So exposure. Does it necessarily mean that you have or will get the disease if you're exposed to some bodily secretions?
The good news is no. It does not
That
mean
is very
that.
good
The
news.
bad news is there's no test ahead of time, to test if you've been truly exposed or will develop the disease. That's why there's that unfortunately long 21-day
21-day
incubation period where you will
incubation
need to be
period.
monitored. But one thing that we like to point out is, we're aware of those cases in Dallas. The first gentleman who was diagnosed within the United States. There were some nurses who ended up becoming infected after having contact with him. They had contact with him once he became severely ill when he was in the hospital. Was reported to have a lot of vomiting, a lot of diarrhea. What we understand from the disease is the sicker you are, the more infectious you are. His family
Makes sense.
members, those who had contact with him when he was starting to feel sick early on, no one developed the disease at that stage. So I think it's good news to kind of look if we can catch someone early, and get them to the hospital when they first start developing fever, when they're not having extreme vomiting or diarrhea. That exposure level is going to be less likely, they're less infectious.
Okay. Very good. If someone is exposed but they're not showing any signs and symptoms, can they still spread the disease?
No, you are only infectious if you are actively symptomatic. So, for example, with our travelers from West Africa, they may or may not have been exposed, but those low-risk people, they're allowed to move about, travel, see people. That's why we do temperature monitoring to make sure they don't develop symptoms, and at that time, we take action to consider them being possibly contagious. But if you're not showing any symptoms, then you do not have Ebola, you are not infectious.
Okay, So not until you start feeling ill, weakness, fatigue, fever, diarrhea, and the fever it's a certain point, right? It's not necessarily a low-grade fever. Doesn't the temperature have to be in a certain range?
Initially, they had it, I believe at 101.5, and then they realized with the second nurse in Dallas that she had traveled with a low-grade fever and ended up developing Ebola. They've kind of lowered their limitations on fever there, and that's just as an added precaution to make sure that we're catching everyone
Okay,
early on.
gotcha. Okay. So, PUI, what does this phrase mean, or this abbreviation mean, and how do we utilize that PUI term?
So when we started developing our plan, we needed a way to kind of categorize these patients. So looking through the CDC and some of their recommendations and what they called these patients is a person under investigation. It doesn't necessarily mean that they have Ebola. It basically means that they're under investigation for possibly having Ebola. So person under investigation.
And so that's the term that our crews would want to use on the radio if they feel that they have identified or suspect that the patient might have EBD.
Correct.
Okay. All right, very good. So how long will it take to decon a medic from their PPE? So once they've transferred their patient at the hospital and they're ready to start the decon process, how long will that take to get them out of those suits?
Once the decon area is set up, roughly about 20 to 30 minutes, they can expect to be in there. The good news is that we have concurrent operations going on during the process when we're notified that there is someone who's going to need to be transported. The decon area will be set up at the hospital at the same time that the patient's being transported. So about the time, if it all times out, the medics arrive and pass off the patient, they should be able to just back right up to the decon area and unload and be taken out of their gear, their PPE.
All right. Sounds good. Quarantine. What does this entail, and what should those in quarantine do or not do?
Quarantine is when, what we would recommend for someone who has a known high level of exposure, but they're not actively ill yet. So someone in quarantine, we would ask them to stay away from friends, family members, be in an area of their home with their own, bedroom, bathroom facilities, unfortunately, for those full 21 days from when they were exposed, just to make sure that they're not going to develop the disease.
So some form of isolation with their own home, in their own home. That's
Ideally, yes,
that's okay.
if that's possible.
Okay. So during the decon process, how come the hazmat crews aren't wearing air packs?
Air packs are a very effective means of protecting your airway from infection or any other contaminants. Unfortunately, we're limited by how much air is in the bottle, which typically is anywhere from 30 to 40 minutes. The operations we're looking at doing with the transport, treatment, decon, and everything, we need roughly about 90 minutes or more to do that. So the filters that we're using are P100 filters and organic vapor filters also on the PAPRs. Very effective for filtering out aerosols. So the personnel will be 100% protected just as if they were with an air pack, but it allows us the operational time needed to do a complete and thorough decon. So
That's important. That makes sense because you don't want to be changing out bottles because you run the risk of the cross-contamination with each if you change out that bottle.
Absolutely.
So that makes a lot of sense. All right, good. Okay. So what kinds of symptoms are we looking for with Ebola patients?
That's a little bit of a challenge. Unfortunately, the early signs and symptoms of Ebola can mimic many diseases, including common ones like influenza. So the fever that we touched on earlier, headache, muscle pain as it develops, vomiting and diarrhea, and then in extreme cases, bleeding, Ebola getting its name as a hemorrhagic fever.
Hemorrhagic fever, right. Okay. So it seems like aside from the typical flu-like symptoms, the bleeding or the petechiae and the recent trip to West Africa. It seems like those would be the biggest two pieces of information.
Yes,
that
I
would
think
kinda
early
lead-
on,
steer you towards the Ebola side.
the most important thing is gonna be that travel history.
All right. Okay. Very good. All right. When the crews arrive on scene, what do you think a better approach would be? For us to go inside or for the patient to come out to us?
Each scene is different, and it just depends on, where the patient is in relation to, is it a condo, is there a lot of people around, is it close quarters, even outside, is there people standing around? So if you suspect a patient that has EVD and there was a lot of people around, I would keep them in the house until we could get prepared to go into the house and get the patient out safely. If it's a normal residential area with a yard, and it's just one patient, it's obviously could be better or more advantageous for the paramedics to bring the patient out. That way, it's an open area that you can deal with the patient at that time.
All right, so it's really,
So-
it's a case-by-case basis.
It's basically a case-by-case basis, yeah.
All right, good information. Okay, so it seems in the past that the CDC never really gave specific instruction to EMS or fire, and now it seems that they're getting more specific. Do you see this as an ongoing trend for infectious diseases, that they're passing that information further down the line and getting that information out there?
Well, for a while, we were kind of grouped in as healthcare workers. So EMS and fire mainly operated under NFPA, but EMS operated under the CDC guidelines for hospital workers. And then as of recently, 10 years ago, it's fairly recent, the CDC came out with pre-hospital care workers. So we have our own guidelines that we fall under now, which has really improved the pipeline of information for exposure control officers.
Good, very good. Is Ebola or other viral hemorrhagic fevers on the Ryan white list? Now, this is something I had to do a little digging into because I wasn't sure myself on what was or was not on the Ryan white list. But in looking into it a little bit, I found that that list is expanding to include viral hemorrhagic fevers. And it's actually not listed under the Ryan White law, but it's listed under the Federal Register. But that hospitals would need to be aware that they do need to contact you in the event of suspected exposure.
Right. The Ryan White law was developed, obviously, when the whole HIV outbreak was going on, especially with Ryan White's what it's named for. But so that once that got developed as law, it was pretty much developed and then set aside, and they thought that they had it covered. It actually expired for a while, and it took the Obama administration, George Bush and the Obama administration, right at that switchover, they actually reinitiated the law. So it comes and goes. It does sunset, and it does have to be re-voted on and signed by the president every so often. I'm not sure what that is, but the Ryan White law, as far as EVD, I don't suspect that EVD will show up on the Ryan White law. I think it'll be its own, especially like in the registry you were talking about. Because the Ryan White law, once it gets too many changes, then it's hard to pass a new updated law like that. So I would look for it to be on something else, like the register and stuff like that. Fortunately, we work very closely with the health department and the local hospitals, so that shouldn't be a problem.
All right, everybody's on the same page as far as sharing all that information is concerned.
Right.
And getting it to where it needs to be. All right. So this quarantine word that we keep throwing around and hearing so often, what exactly is quarantine and who is going to be quarantined?
I think right now that's one of those questions that's not quite fully answered. The CDC's developed a list of what they're considering high-risk or low-risk exposures. And in terms of EMS and first responders, those who are transporting a patient but that are wearing full PPE and they don't feel like there's been any breaches, they're considering that at this time a low-risk exposure. They won't need to be quarantined, meaning, kept away from work, kept away from their families for those 21 days, but they would be monitored from the health department twice a day for those temperature checks. However, if there's any type of PPE breach that they're concerned about at that time, out of an abundance of caution, that would be considered a high-risk exposure. And that point, that quarantine, that we discussed earlier, being separated and isolated, self-isolated, would probably have to be in place. But again, since this isn't something that's happened yet here in the state of Florida, I don't think we know, what the final guidelines are gonna be, so that's something that's fluid, and we're gonna have to keep up with the recommendations on that.
Okay, very good, thank you for that. So when our crews are in the level C suits and the PAPR device is on, if that PAPR were to shut off, say the battery died, is that a huge concern? Are they still gonna be able to breathe inside of those suits?
Yeah, they'll still be able to draw filtered air through the filter. It's just not going to have the air conditioning effect that the blower provides. They still, the good news is that those batteries last for over 12 hours. I've run them
So
up to
plenty of
15
time.
hours myself.
Plenty of time.
Yeah, they're very good pieces of equipment. But if they do have a problem with their equipment, it's important that they do extricate themselves from the hazard area and get the problem corrected as soon as possible.
But if they were in the middle of transport, say if it was a 10 or 20-minute transport to the hospital, and the PAPR device were to shut off or the battery were to fail, I mean, they would be okay in that suit until they got to their destination.
Yes, and as always, if, in that case, if they did start to experience any kind of dizziness or odors or anything that's unusual, then they'd have to advise, and they could redirect right to the hospital, and we'd get them out of it as quick as possible.
Gotcha. Sounds good. Okay. I also learned during some research that there have been at least 4 other outbreaks of hemorrhagic fever in the United States that got little to no media attention. There was Lassa fever and the Marburg virus. They were diagnosed and treated right here in the U.S. without so much as even a peep from the media. So what part do you think the media plays in infectious disease control?
Well, I can't speak for the control portion. I think, rightfully so, the Centers for Disease Control, has really taken a step up to get all of these new guidelines in place and push it down locally. But I do think the media has played a role in the public fear of new infectious diseases. And when Ebola was in the media on a daily basis, that's when, here within Manatee County, when we saw those false alarms and those scares, all of our hospitals went through it. We had incidents at the jail, and all of them were completely unfounded, but I think they were driven by limited knowledge and what the media was portraying. And I think we've noticed now that Ebola's kind of gotten out of the limelight, everything's been quiet, and I think that's a link there, a distinct link.
It was definitely a hot topic for a while there. So, I mean, along with infectious disease, hemorrhagic fevers aren't the only infectious diseases out there. There are many others, and we are upon a season now, flu season, which is a lot of people forget about as being an infectious disease. And what precautions can we take or should we take as far as the flu virus is concerned? What can we do to protect ourselves?
I think it's pretty obvious that you're much more likely to get in contact with influenza versus Ebola. And we are in flu season, and what we're seeing in Manatee County and statewide is an increase above normal, what we expect to see for flu activity this time of year. So with that said, it's not too late to get vaccinated. The Centers for Disease Control and the Health Department do recommend that annual flu vaccine. And it has come out in the media that one of the highly circulated strains this year, unfortunately, is not included in the flu vaccine. However, there are some circulating viruses that are included, and it could offer some limited protection to that strain that's circulating. So with flu season really going through the end of April to May, it's definitely not too late to get that flu vaccine, and that's something that we're strongly encouraging.
And even more so for healthcare workers, should definitely be vaccinated.
Yes, you'll
right?
protect yourself, and you'll protect patients by keeping yourself
Does
vaccinated.
the flu vaccine, does that prevent you from being a carrier if you're vaccinated?
No vaccine is 100%, unfortunately, especially now that there's a strain circulating, that's not covered. But it's gonna offer you, it's our best line of protection that we've got. So, it either will hopefully you can avoid getting sick, or at least limit your severity of your illness by getting vaccinated.
Sounds good. Is it safe to use aerosols around the PAPR devices?
Yes, it is. The aerosol, the PAPR devices themselves are a Class 1, Division 1, Group A rating, which means that they're safe to use in pretty much any atmosphere as far as sparking, dust, flammable atmospheres, that kind of thing. So they're rated for that. The other added advantage too is that the aerosols, the organic vapor cartridges that are on the units that EMS is using, filter out the aerosol, and what aerosol is just a liquid that's suspended in air that goes into the filter that is trapped there, and the only thing that gets past that filter is just pure fresh air. So that's what's being fed to the medic, that's what's being fed to the person wearing that gear. We've done tests with it beyond what was provided with the information from the manufacturer, where we've taken it, sprayed, overloaded the PAPRs with aerosols. And we use a disinfectant aerosol during our process. It's an additional thing that we do to help go one step beyond in the decon process. But we have loaded those filters down. We've had air monitoring equipment inside the PAPR hood. No indications, even down to the parts per million, it's shown clear. So there's no chance of any kind of flammability inside the suit, no chance of the aerosol making it pass and irritating the wearer. So very confident that
Wow,
we are safe.
That's amazing. You guys have really done your homework as far as that's concerned. That's great. Looking out for our guys is awesome. So how many personnel should go into a structure to interview a patient who is a PUI?
Well, if the question is just that simple, then it's one. It would be the charge paramedic. But we suspect, unless we get information from the Department of Health that we have someone in the area, we suspect that you are going to get dispatched and arrive to the call and not know anything about the patient other than flu-like symptoms. And we run quite a few of those, so at least the paramedic and the paramedic's partner would be inside the structure. But if we're going to a residence where we already know or suspect that the patient has EVD, then one person to interview the patient.
And when you say that we already suspect, this information would be gained from dispatch before our crews even got there, right?
Right, and then
Because they're asking those
and
questions.
then again, what triggers that would be further knowledge of someone living in the area with EVD or possibly PUI living in the area or an outbreak in Florida before we even start that screening.
Okay. What should the crew do if they suspect that the patient is a PUI or a person under investigation?
So once they get on scene and they ask those questions, and if they end up asking the questions and the patient answers yes to all three, then they're going to notify their supervisor. And immediately an EMS supervisor will come out to the scene, confirm with the crew what they have, and then the supervisor is going to set up a command post and contact the Department of Health so that they can ask the questions and kind of regroup, get everybody on the same page, and so that everyone that has a key role in this all agrees that this is a person under investigation and we're going to move forward with the Ebola plan.
Okay, and so what information would you relay to the health department? Is this the same, whatever information you gathered on scene, the simple dispatch information, what information do they need to know?
No, those questions or the information we gather is going to be directly from the patient ourselves that we're asking.
Okay.
What symptoms are they having? Where have they traveled? Have they been in contact with anybody or any dead bodies in that area in West Africa? The area and the time frame is going to be key for Carrie to make her decision of, yes, this is someone that we possibly will
And then together
test.
you make that decision to put the whole rest of that process
Correct.
in motion. Okay, very good. All right. Do the PAPR devices on the level C suits supply oxygen?
No, they don't. What they do is they're just an air filtration system. So we want to warn anyone who's using them that anytime you have to determine what atmosphere you're going to be going into. They're great at, they're perfect for situations where you just have dust or aerosols or some kind of contaminant that's floating in the air that can be filtered out. But unfortunately, if you're in an atmosphere that doesn't have enough oxygen to breathe, then no matter how much filtration goes on, there's not going to be enough oxygen being supplied to the person wearing the PPE to, you know.
Makes sense. It's not an air pack, it's just filtering the existing air atmosphere that you're in.
Absolutely, absolutely.
Okay, good information. So what kind of treatment should we be doing to these patients when they're in the back of our units?
The CDC doesn't recommend any treatment for these patients, so we're not doing any invasive treatment, and we're limiting our contact, obviously, with the patient. If we suspect the patient has EVD, we're limiting as much as possible contact with the patient. No IVs, no advanced airways. Obviously, oxygen is okay, but other than that, it's basically just monitoring and transporting.
Just very, very limited contact. Okay, that's good, makes sense. What should fire and EMS personnel do if they come into contact with bodily fluids of a PUI?
I think at that point, they would need to notify their supervisor, and then the health department would become involved. And again, this is one of those things where the guidance isn't quite clear, if we would recommend them to go into that quarantine, stay off of work. Again, it's that 21 days, which is that unfortunately long incubation period, but that's, you want to wait that full amount of time to make sure that you're not going to develop illness. So at that point, the health department would become involved in determining the best way to protect that EMS worker and their families and their coworkers, and we'll determine at that time how best to, quarantine or do temperature monitoring for them.
Okay, because that in essence, I mean, even though it's not a needle stick, so to speak, when you think of exposures, that's the kind of things you think of, but just coming in contact with that fluid is an exposure.
So it'll be, case by case basis on, what is the PPE breach that we're suspecting, what was there a true contact? I think that's going to be, once something happens in Florida, I think all of those answers are going to be much clearer on how we're going to, hopefully we'll never have to get there.
Gotcha, yeah, I hope so too. Okay, so let's move on here. What would you say is more important, the BSI that you're wearing or the actual decon of the PPE?
I think BSI, to protect yourself right from the jump would be most important. The decon is kind of an afterthought. We try to do the best we can to, eliminate any cross-contamination, but it's always best to protect yourself.
Right, so that whole donning process just becomes all the more important. What kind of disease is Ebola, and what does it do to its patients?
It is a virus, and as we've discussed, it's got the early onset symptoms that mimic many other common diseases. So you're going to start with the fever, headache, malaise, muscle pain, and as it develops, that's when the profuse vomiting and the diarrhea, the hemorrhaging can start. Unfortunately, there's no treatment for Ebola, no antivirals, anything like that, and so what has been recommended is if someone is at the early stages of the disease, the quicker they can get into care, into the hospital, and that's all going to become supportive care, IV fluids, electrolyte balance. That's what they can do best to kind of keep people from declining too rapidly.
So what kind of time frame, for onset of symptoms, someone that's exposed, and then from the time they're exposed to the time they start developing symptoms, what kind of time frame are we looking at there?
Average 2 days up to 21 days.
Oh, wow, so that makes sense, the 21 days, so that's kind of
And they say on average, I believe, around 8, so a week to 2, but, we're going to keep that 21 day as our farthest incubation period from when someone may be exposed to when they start developing those
So
symptoms.
generally, the symptoms come on fairly quickly.
Potentially. It's hard to say with something that we're still learning so much about, what a definitive.
It's probably case dependent too, depending on age, your immune system, if you're sick already. There's probably a lot of factors that come into play as far as when you can develop those symptoms. Okay. All right. So during the decon process, what exactly is the hazmat team spraying on the level C suits?
We have a disinfectant, pretty common. It's a disinfectant. It's certified for non-enveloped viruses, which are a little more tougher to kill than Ebola. It's Lysol, basically. It's very effective. And what it does is it allows us to do a hands-free, waterless pre-treatment of our personnel before they start the decon process. The one advantage to doing this is that it is hands-free. The first contact you have with someone who's been in an atmosphere that has a contaminant in it, that's when your potential for cross-contamination begins. So by doing this and using the aerosol, we basically have a way of just knocking down the virus beforehand, and then start the CDC process with the bleach wipes. So this is one step beyond what's been indicated, but it seems, unfortunately, we're trying to, process is perfect, and even with the step-by-step instructions, we're kind of anticipating that we'll miss something. So by adding this one extra step in there, we try to deactivate as much of the virus as we can before we lay hands onto the person in the PPE, and thereby one less chance of cross-contamination during the process.
Very good. And with the Lysol, they'll smell good too.
That is true.
Yeah, all right. How and what is the best way to package a PUI patient?
In our plan, what we're gonna do is put them into if possible, dealing with patients is, each case is a case-by-case basis, but we would put them into a onesie suit to kind of limit their exposure to other people. And then we'll have them sit down on an EMS tarp on the stretcher and then kind of encase them during transport.
All right, sounds good. If there's a breach of the suit during the transport of the patient, what should we do to minimize that exposure? So if I'm in the back of the truck and I see a tear in my suit, what can I do immediately to kind of minimize anything getting in there?
Tape.
Tape is your friend, huh?
Tape is your friend, yeah. Limit contact as best you can. That's something we're just gonna have to address after the fact. Nice thing is that, I should say there's nothing nice about Ebola, but it's not an immediate hazard to you. If you get an exposure, you have time to get treatment, be monitored, all that. So the key thing is not to panic, just note it, tape it, to help try and keep any other contaminants getting in there. An application with any kind of disinfectant that's on hand is not a bad idea. Some bleach wipes to wipe down the area, but just try to minimize any further exposure, and then, if there is an exposure, we'll deal with that.
I
So
think that was, I'm sorry, a lesson learned from the healthcare workers in Dallas who were exposed and ended up becoming ill. Nothing's been officially released about that, but some of the speculation is that, when they were around this patient who was actively ill, vomiting, diarrhea, that they may have not taken off their PPE correctly. So I think, panic may set in if you feel like you've been exposed, but I think it's really important to take your time and do the disinfecting and everything properly, instead of rushing to get everything off.
Makes sense. All right. So what happens to the ambulance after all this is done?
Once we can complete the decon process, get the personnel out of their suits, the hazmat team will go in and decon the ambulance. Right now, the EMS will basically line the entire box of the ambulance, the interior transport compartment, with plastic. It'll be taped. Then our job will be to come in after the fact, take that down, disinfect the ambulance with a disinfectant. We'll be using a 4-to-1 bleach solution. Disinfect it, let it dry. We'll do it a second time, let it dry, and we should be good to go from there.
All right, very good. That's all the questions that I have. I think that's going to conclude our session. I thank you all for your time and your fabulous insight, and thank you very much.